Your cat cannot speak. They cannot point at what hurts. They cannot tell you they're scared, in pain, or struggling. And here's what makes this harder. Cats are hardwired to hide suffering. It's not stubbornness, it's survival. In the wild, a visibly sick or weak animal becomes a target. So cats evolve to mask pain, mask illness, mask distress, with a completeness that would fool even the most attentive owner. But they cannot hide everything. There are 7 signals, subtle, easy to miss, easy to dismiss, that your cat uses when something is wrong. Not because they chose to tell you, because they couldn't not. By the end of this video, you will know everyone, and knowing them might be the most important thing you ever learn about your cat. Every cat hides sometimes, that's normal. But when a cat who normally moves through the house freely starts spending hours in one tucked, enclosed, dark space, under a bed, behind a sofa, inside a wardrobe, something has shifted. Hiding is the most ancient pain response a cat has. In the wild, it's what you do when you need to recover but can't show weakness. In your home, it's your cat telling you, in the only way available to them, that they need to be away from everything right now. One day of hiding after a stressful event, visitors, loud noise, change, is normal. Hiding that lasts more than 24 hours, returns daily, or involves a cat who is normally social and confident. This needs your attention immediately. Note when the hiding started. Note the location. Check gently, not forcefully, whether they respond to your voice. If the hiding persists beyond 24 hours with no obvious cause, call your vet the same day. And if hiding is the first thing most owners miss, the second sign is something that happens in plain sight. Something you probably see every day and completely misread. Cats spend between 30 and 50% of their waking hours grooming. It's temperature regulation, it's social bonding, it's stress management. It is a fundamental expression of their well-being. When it changes, something is wrong. Over-grooming, licking one area repeatedly until the fur thins, is almost always anxiety or pain localized to that spot. Under-grooming, a coat that looks dull, matted, unkempt for a cat who is normally fastidious, signals that your cat has stopped investing in themselves, which is one of the clearest indicators that something serious is consuming their energy. Veterinary dermatologists note that psychogenic alopecia, hair loss from stress-related overgrooming, is one of the most underdiagnosed conditions in domestic cats, frequently mistaken for simple habit by owners for months before the underlying cause is identified and treated. Any bald or thinning patches, any sudden coat quality change over 2 weeks, any grooming behavior that seems driven, compulsive, or focused on one location. All of these need veterinary assessment, not monitoring. Photograph the area. Note when you first noticed the change. Tell your vet exactly how the grooming pattern differs from your cat's normal behavior. Your baseline knowledge of your cat is the most valuable diagnostic tool your vet has. If you're watching this thinking of your cat right now, that instinct matters. Hit like and subscribe. Flora exists to help you be the owner your cat deserves. Most owners notice when their cat stops eating. That's the obvious signal. But the less obvious, and equally serious, is the opposite. A cat eating significantly more than usual, eating faster, seeming desperately hungry despite normal portions. These can signal diabetes, hyperthyroidism, or parasites, conditions that are entirely manageable when caught early and very serious when missed. Both directions matter. Feline internal medicine specialists cite appetite change as one of the most reliable early indicators of systemic illness in cats, with studies showing that owners who reported the change early significantly improved treatment outcomes across a range of conditions, including kidney disease, diabetes, and gastrointestinal disorders. Any change in eating pattern that lasts more than 48 hours. A cat who goes more than 24 hours without eating at all. This is a veterinary same-day call. Cats who don't eat develop hepatic lipidosis, liver disease, rapidly. This is one situation where waiting to see is genuinely dangerous. Know your cat's normal. How much do they eat daily? How fast? At what times? When you can describe the deviation from that baseline precisely, you become your vet's most valuable resource in getting your cat the right help fast. Signs 1 through 3 are ones most owners might notice. The next sign, sign 4, is the one that sends cats to emergency vets because it was missed for too long, and it happens in a room most owners don't pay close enough attention to. This sign saves lives. The litter box is a diagnostic window into your cat's health that most owners look past, or away from, every day. But what happens in there tells a story that is impossible to read any other way. Going outside the box, especially from a previously reliable cat, is almost never behavioural. It is a medical signal. Urinary tract infection, kidney disease, bladder stones, constipation. Your cat is not being difficult. They are telling you that using the box is painful, and they are trying to communicate that to you the only way they can. Blood in urine, straining, frequent small amounts, any male cat who hasn't urinated in 12 hours. This is a veterinary emergency. Urinary blockage in male cats is fatal within 24 to 48 hours without treatment. If you see a male cat going to the litter box repeatedly and producing nothing, call a vet immediately. Urinary tract diseases are among the most common reasons cats present to veterinary emergency services, with outcomes strongly correlated to how quickly the owner recognised the litter box signs. Owners familiar with their cat's normal litter box behaviour consistently identify problems faster and achieve better outcomes. Know your cat's normal. How many times a day? What size? What consistency? The litter box is not something to avoid looking at. It is one of the most important health checks you do, every single day. A cat who has never bitten or scratched, who suddenly does when you touch a specific area, is not being aggressive. They are telling you that place hurts. Cats cannot say, "Don't touch my lower back." They cannot say, "My left hip is painful when you pick me up." What they can do, what their biology compels them to do, is react when something that hurts is touched. Sudden touch-reactive behaviour is one of the most reliable pain indicators in feline medicine. Arthritis, dental pain, injury, internal tenderness. The aggression is not the problem, it is the message. And the message says, "Something here hurts, and I need you to find it." Any sudden change in how a previously gentle cat responds to being touched, picked up, or stroked in a specific area, not occasional overstimulation, that is different. Consistent pain-reactive behaviour that is new and location-specific. This needs veterinary assessment. Note exactly where the reaction occurs. Is it consistent, always the same spot? Does it happen when you pick them up from below? Does their whole back ripple when you stroke it? These details help your vet locate the source fast. And now the two signs most owners don't just miss, they actively misread. Because both of them look like something completely different. Sign 6 looks like your cat is just being cute. Sign 7 sounds like they're happy. Half-closed eyes. On a sleepy cat, this looks like contentment. It looks like the slow blink of a cat who is perfectly relaxed. It looks honestly adorable. But there is a specific version of this that is a pain signal. When only one eye is partially closed, consistently, not occasionally. This is called blepharospasm. It is the involuntary tightening of the eye muscles in response to pain or irritation. Corneal ulcer, conjunctivitis, glaucoma, foreign body, dental pain radiating to the eye area. It looks like a soft expression. It is almost always pain. Veterinary ophthalmologists identify unilateral blepharospasm, squinting affecting one eye, as one of the most consistently missed early warning signs by cat owners, or with average time between onset and veterinary presentation, often exceeding 3 weeks due to the behaviour being mistaken for normal relaxed expression. One eye consistently more closed than the other. Discharge from one eye, pouring at the face near the eye. Any cloudiness, redness, or visible change in the eye itself. Any of these, same-day vet call. Eye conditions in cats escalate rapidly. Compare both eyes in good light. Do they look symmetrical? Move in the same way? Respond to light the same way? Your cat's eyes should match. When they don't, something needs attention. This is the sign that surprises people most, because we are taught, from the very first cat we ever met, that purring means happy, and most of the time it does, but not always. Cats also purr when they are in pain, when they are stressed, when they are dying. The purr is not exclusively a happiness signal. It is a self-soothing mechanism. The same 25 to 50 Hz frequency that promotes healing in human tissue also regulates the cat's own nervous system. It is how they calm themselves when the world, or their body, is overwhelming. Research on feline vocalizations confirms that cats produce purring in a wide range of emotional and physiological states beyond contentment, including fear, pain, and distress. with the frequency and rhythm of distress purring differing subtly but measurably from contentment, purring in ways that trained ears can learn to distinguish. How do you tell the difference? Context. A happy purring cat is relaxed in body, slow in movement, settled in position. A cat purring through distress is often tense in body despite the sound, hunched, eyes tight, position uncomfortable. A cat who is purring but also hiding, not eating, or showing other signs from this list. The purr is not reassurance that they're fine. It may be the opposite. Trust the combination of signs, not just the sound. Know what your cat's happy purr looks like physically. A relaxed body, slow blinking, loose posture. When the purr is present but the body says something else, believe the body. Your cat cannot tell you when something is wrong, but they have always been trying to show you. In the hiding, in the grooming, in the silence, in the signs you now know to look for. You are their only voice. You're the only one who can hear them. Now you know what to listen for.